How long do facelift results last?
Facelift surgery is often perceived as the pinnacle of treating changes caused by facial aging. The surgery does require investment in time and resources, so it's natural for someone considering a facelift to inquire about how long the benefits of the surgery should last. I'll discuss how I counsel my patients as to the longevity of facelift surgery for their individual situations. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been performing facelifts throughout my career and have brought my own innovations into the procedure, such as performing facelift surgery under local anesthesia with light IV sedation instead of general anesthesia. I've also modified different types of facelift incisions and applied advanced wound healing material for better incision healing. These have all helped make post-surgery recovery easier and faster for my patients without compromising the quality or longevity of results. Oftentimes, people assume facelifts as being permanent. However, no cosmetic procedure is truly permanent since no procedure stops the aging process. I stress how the objective of a facelift from my personal aesthetic is to help patients look more like younger versions of themselves. This means I strive to maintain their individual, unique facial character. Generally speaking, I'd estimate the benefits of a facelift can last 5 to 10 years. There are individual factors affecting the perception of longevity for each patient, in particular, the age at which the facelift was performed. The timing of when in a person's life a facelift is recommended in my practice has evolved as other aesthetic procedures have been introduced. For example, to compensate for bone and soft tissue volume loss associated with aging in the mid-30s and later, I use long-lasting injectable fillers which I place at the bone level using a technique called structural volumizing. The results from structural volumizing can actually appear comparable to a surgical facelift. Generally, a facelift is recommended for significant changes in the skin, muscle, and soft tissue, which results in laxity and downward descent. This tends to happen from age 50 and older. There are some cases where a younger person may have a limited facelift due to genetic factors which cause earlier tissue laxity. As is often the situation with cosmetic eyelid surgery, the age when surgery is performed is important in predicting the longevity of benefits. For example, a person who has upper eyelid surgery done when they are in their 30s will have results which will change with age differently than a person who has the same surgery done in their 60s. It's important to understand that aging changes are not just limited to the skin. The most significant changes are actually deeper, which is at the bone level as well as the soft tissue just below the skin. As I mentioned earlier, facelift results can be expected to last in the 5 to 10 year range. My aesthetic for all my cosmetic surgeries as well as non-surgical procedures such as facial fillers and Botox is for my patients to retain their facial characteristics that are unique to them while helping them look younger and refreshed. Some facelift surgeons believe in a more exaggerated aesthetic, and they have patients who actually want that look. It's common for patients inquiring about facelift surgery to be aware that there is something called tightening the muscle for a facelift to be performed optimally. This means that any facelift operation involves some manipulation of a very important support structure called the SMAS, or the superficial musculoaponeurotic system. You can think of it as the foundation that helps reinforce and support the position of the skin that is being moved essentially upward. There is a lot of finesse to facelift surgery. The objective is to optimize aesthetic repositioning with resultant improvement in the neck angle and the jawline while minimizing the visibility of incisions and preventing any distortion of the earlobe. I routinely perform my facelift procedures under local anesthesia with light IV sedation, so patients can recover more quickly than they would if the surgery was performed under general anesthesia. By doing this, our patients are able to leave our operating suite, which is located in our office, in about 1 to 2 hours after surgery with a small facial bandage, to go home and recover. This is in contrast to general anesthesia, where it's routine for you to have to stay overnight in a facility with facial drains and a nurse to monitor you. My facelift patients will generally experience limited swelling and some mild bruising. They usually return to work and their normal routine in about a week to 2 weeks. Technique combined with the application of stem cell-based wound healing technology, such as the use of extracellular matrix and PRP, contributes to this quicker recovery. As with any surgery, the healing process continues for about 1 year. Regardless of facelift technique, the skin and underlying tissue does relax over the course of 1 year, since facial movements and tissue elasticity creates a certain level of softening of the initial higher level of tissue tone right after surgery. I educate my patients to expect this before surgery and to remember that young faces aren't tight or pulled faces. A younger face has a youthful appearance based on facial balance and skin quality. It's important to recognize that once the soft tissue and the skin is repositioned after facelift, there is an additional opportunity afterwards to further improve your appearance by addressing volume loss. As we get older, facial volume from bone, muscle, fat, and soft tissue diminishes. Many times I actually combine volume enhancement with facelift surgery through the placement of implants and cosmetic fillers. For the purpose of restoring facial volume related to bone loss, I perform a specific technique called structural volumizing. This is an approach where long-lasting cosmetic fillers, such as Juvederm Ultra Plus, are placed much deeper than is done with traditional techniques. This means that the fillers are placed at the same level as facial implants, which is just above the bone structure and under the muscle layer. I'm able to create a more defined facial volume and structure. Traditional placement of facial fillers is in the soft tissue layer just beneath the skin. The filler in this space can shift and make you look doughy and pillowy. In contrast, I perform structural volumizing to create a stable and defined contour. I often see people who have had their facelift performed elsewhere and question why they don't look as good as they had hoped. For these patients, I routinely place filler at the cheeks, chin, and jawline. Now their facelift results look much better because there is improvement in the underlying facial structure. This approach has been a relief for many people who had facelift surgery and thought they'd need to have another facelift surgery. Instead, in less than 30 minutes in an exam room, they look significantly better with structural volumizing. While the benefits of a facelift can be present for a long time, it's important to remember that a facelift does not address bone volume loss or, of course, stop the aging process. It's important to have a proper evaluation to look at the different aspects of your facial aging. In my practice, the long-term strategy after facelift surgery integrates volume correction and other non-surgical procedures to help my patients look their best. I hope you found this information helpful. Thank you for your question.